Here we go, team.
Yay.
Raised eyebrow. Hi, I'm Dr. Wong. I'm a chiropractor.
Clarissa, registered massage therapist.
And today we are manual therapists, trying to figure stuff out.
Mm-hmm.
So we're looking at different techniques that we see, and we're trying to figure out what they are, and if we can figure out what it is. So today we're looking at,
Schiptseobraznoe is what we think it's pronounced as. It's Schiptseobraznoe. The description of this technique is carried out with the thumb and with the fingers of the other hand, which is where we're really confused on this one. In longitudinal and transverse tendons during the massage, small muscle groups, ears, nose, face to local actions. So I'm thinking there's a translation issue of this where they've chosen to use the thumb of the one hand and the fingers of the other one. I think they might have meant the fingers and the thumb of the same hand.
Maybe.
It's my assumption.
Hi, Dylan.
Yeah, Dylan is our hand in the background.
Yeah, we're just
maybe you should grab a chair and join it.
So we looked at some other descriptions of Schiptseobraznoe. This one says, perform Schiptseobraznoe folded fingers, usually 1, 2, 3, or only 1, 2 fingers for massage of fingers, feet, tendons, and small muscle groups, face, ears, nose.
Okay. So that would make more sense. So like in terms of this action, so 1 or 2 fingers or 1, 2, and 3 fingers, right?
Mm-hmm.
So, and from the areas that they're saying, so the ears, the nose, the face. It's like they're talking about small little areas. So like the fingers onto the ear. So I'm assuming they're talking about like a little circular need where the fingers are kind of pinched in with kind of rounded fingers. So they're doing this. If it was onto the nose, I would assume that they're doing something in terms of this action. What I'm a little confused about is when they're talking about longitudinal and transverse tendons during a massage. So
maybe it's like, because they might be meaning like if a tendon's coming down like this, or I guess like this, maybe more of a pulling the tendon or going up and down the tendon. I'm not sure if they were saying longitude or transverse, referring to the tendon or the stroke.
So which tendons, based off of this technique, do you think that they would be referring us to use this on, though? There's only one that
like
my
Achilles,
brain...
maybe?
Yeah, Achilles is about the only one my brain would kind of really go straight to because it's one you could grasp and actually hold. Maybe to the biceps tendon a little bit, but there's very few tendons I feel like you'd be able to grab in this fashion to be able to do this little fingertip need, like pincer fingertip need too.
And I'm wondering if it is a translation issue because they refer specifically to tendons. Tendons are used to connect muscles to bone. If there's a connective tissue connection between, that was a weird way to say it, between two bones, like a lot in the ankle, that is referred specifically to a ligament. So there is a difference between ligaments and tendons, so we don't know if they mean tendons as in medical anatomical terminology tendons or just like connective tissues that contain these types of collagen. Another description of it was stroking usually use a spot where you want to separate massage a small group of muscles or tendons. This method is effective for influencing the pockets of pain. When the Schiptseobraznoe stroking middle index and thumb required to lay down, pinch, grabbing them, the desired area of the body, massaging it in a straight line. So again, it's probably a bunch of translational stuff, but it kind of makes me think it's like maybe it's like some kind of like pinching thing where you're pulling up and you're kind of shimmying the tissue.
Well, it could be a back and forth, or it could even just be the stationary need kind of on that particular tendon or structure that they're talking about. Because that's where my brain goes, especially, as I said, with the ears and the nose, because you're typically doing these little small circular kind of strokes to it as opposed to these straight back and forth motions. So I think, again, with the translation of these techniques, a lot of them fall underneath the pétrissage category, which talks about circular, techniques. So more pressure on the up and out, less on the down and in kind of pressure, but using various parts of our hands or forearms or knuckles, whatever it might be, to actually perform it. But it sounds like they're taking some of those and they're mixing them with a bit of the neuromuscular techniques like muscle stripping and a few other techniques.
Okay. Like, also the thing that I thought about when we were, like, talking about this and you mentioned the nose and you mentioned doing here is sometimes when people get headaches, they'll, like, kind of try to massage close to their sinuses and just kind of pinch it and, like, I guess, like, oh, that feels great. Roll the tissues a little bit. So I was just thinking about that. Or when people, when you're petting a dog or a cat and you're petting their ears, it's a very small area, you just kind of, like, grab that tissue and you're just gently massaging this, like, a bit of a kneading circular motion. Or you could also change it, instead of just doing a circular motion, to just do a gentle stroking motion. So I was also thinking maybe it's that.
Maybe. We're still up in the airs about it, but I think we've generally figured out the technique.
Can we high five on that?
Yeah, I think so. Considering this one took us over a week to understand because of the whole thumb and opposite fingers.
Yeah.
We were really, really confused. We were actually trying to figure out how we were going
like,
to
are you
do
pushing
this, like,
your
on
thumb
the same structures.
with the other fingers?
Yeah.
What's happening?
It was very, very confusing.
So, yeah, I guess that's it for this week. If someone out there watching us maybe has an actual idea and actually knows what we're talking about and can coherently show us, that'd be super great.
Yeah.
If there's something you don't know and you want us to try to figure out, send us a link, post it, comments, whatever it is. And again, we will try to figure it out.
Yeah. And Happy Women's Day.
Happy Women's Day.
Yay,
Can we high five on that? Yes. So, with Women's Day, I'm sure some people in North America have heard that women were encouraged to take the day off and not buy things and stuff like that, just to see the impact that it would have if women weren't around. Well, other than, people with uteruses who are typically, if they're cisgendered women, give birth to human beings. That's pretty great.
Yeah.
If we didn't show up to work, then our patients would be high and dry. And if we didn't teach, then our students wouldn't learn. Yeah, so cool. Woo.
Yeah.
Women!
Go women!
Not just cisgendered. We appreciate all women.
Yeah.
So yeah, super cool. Anyway, again, let us know if you know what we're actually talking about, or if we don't know what we're talking about. But you can offer constructive criticism, because telling us to suck doesn't teach us how to be any better.
No.
Cool. All right. That's
Great.
it. Hurrah!